Hi students, this is Surender, Department of Physician Assistant, Assistant Professor from School of Allied Health Science, Vinaya Mission Research Foundation, deemed to be university. I am going to take a session of hydrocephalus. The name itself, hydro means water, cephalus means inside the brain. So inside the brain. What is that water means? So CSF, that means cerebrospinal fluid, is a clear fluid which is formed as an ultrafiltration of plasma. So you all know about that plasma. So CSF is present in both intracranial and spinal compartment. So CSF is both in intracranium as well as in the spinal compartment. It is continuously being secreted by choroid plexus at the constant rate inside the third and fourth ventricular of the brain and circulates in subarachnoid space of the brain and spinal cord through the CSF pathway. So you can see this image. So this is a third ventricular. So choroid plexus is there. So CSF is secreted from this part so to the brain, that means brain and spinal cord. So it is continuously being secreted by choroid plexus at the constant rate inside third and fourth ventricular. So this is very important. How much of the volume is produced by an adult? So you can see this slide. The total volume of CSF in the adult is approximately 140 ml. So CSF is produced at the rate of 0.2 to 0.7 ml per minute or 500 to 700 ml per day. So although it is secreted by choroid plexus 500 to 700 ml per day. So the main function of CSF is to reduce bone size of the brain. So it also supply nutrients as well as helps in removal of various substances like ammonic acid, neurotransmitters, metabolic byproducts from the cells. Although the CSF is reabsorbed into venous system via the arachnoid granulation, these are the finger-like evacuation of the subarachnoid space while the project into the cerebellar venous sinus. So you can see this image. So although I can explain the before slide, so CSF is produced in both choroid plexus and third ventricular or lateral of third ventricular and fourth ventricular. So CSF is produced by this way. It can circulate toward the brain and spinal cord. So brain and the spinal cord. So it is reabsorbed. So it is reabsorbed in the arachnoid granulation. So through the arachnoid granulation, the extra CSF has to be absorbed. So by this condition, what the condition is? Hydrocephalus. So the hydrocephalus means, I also said hydro means water, cephalus means inside the brain. So in the CSF is not reabsorbed in the arachnoid granulation. So what it's happened in hydrocephalus means the CSF is stayed in the cephalic region. So the brain appearance is about this kind of appearance, cephalic appearance, due to this CSF is not drained properly in the arachnoid, that means arachnoid granulation. Okay. So what is brain ventricle? So this is inside the brain ventricles. Your brain floats in the bath of cerebrospinal fluid. So this fluid also fills large open structures called ventriculars which lies deep inside your brain. These fluids filled ventricular helps keep the brain buoyant and cushioned. So CSF, how the CSF importance to our brain? So you can see this slide. So keep the brain buoyant, allowing the relatively heavy brain to float with the skull. So you can also cushioning the brains to prevent injury. So you can see this image. So brain is covered with the CSF. So it is like cushioning inside the CSF. So remove waste products of the brain metabolism. So brain's metabolism has to be removed by the CSF. Flowing back and forth between the brain cavity and spinal column to maintain a constant pressure with the brain. The compensating of changes in the blood pressures in the brain. Although, so these are the main common and important roles of CSF. So the real condition is about hydrocephalus. So as I previously said, hydro means water, cephalic means, that means inside the brain. So hydrocephalus is a buildup of fluid in the cavities, ventricles which deep inside the brain. The excess fluids increases the size of ventricles and put pressures on the brain. So this is the real condition. The CSF not reabsorbed in the arachnoid granulation. So the CSF is stayed inside the cephalic region, that means brain. The excess fluid increase the pressure of ventricles and push pressure on the brain. So CSF normally flows through the ventricles and patches the brain and spinal column, but the pressure of too much cerebrospinal fluid associated with hydrocephalus can damage brain tissue and causes a range of brain function problem. So hydrocephalus. So what is the age criteria? So although it is an congenital condition, mostly students you can correlate with the clinical findings. So hydrocephalus mostly affected in the congenital, that means during birth time itself. So hydrocephalus can happen at any age, but it can occur more frequently among infant and adult over the period of 60 years. So surgical treatment of hydrocephalus can restore and maintain normal cerebral fluid in the brain. So different therapies are often required to manage symptoms or problem resulting from hydrocephalus. So this image you can see that the hydrocephalus with increased head circumference in a 3-month-old child. So inside there is an CSF that collectively inside the brain itself. So basically it is a congenital condition. So what are the main causes? So main causes of this condition means hydrocephalus is caused by an imbalance between how much cerebrospinal fluid is produced and how much is reabsorbed into bloodstream. As we discussed previous slide, so cerebrospinal fluid is produced daily for an adult is 500 to 700 ml per day. But it is reabsorbed in the arachnoid granulation inside the brain. So this mismatches can accumulate the CSF in the brain. So CSF fluids is produced by tissue lining of the ventricles in the brain. It flows through the ventricles by way it interconnection channel. The fluids eventually flows into space around the brain and spinal column. It is absorbed primarily by blood vessels in the tissues on the surface of the brain. So three main causes. So first one is obstruction. Obstruction in since the most common problem is partial blockage of the flow of cerebrospinal fluid either from one ventricle to then another form of ventricles to other spaces around the brain. So obstruction, what does the obstruction means? The partial blockage of flow of cerebrospinal fluid. So you can see this image. So partial blockage in the CSF production, it can be produced extra. So this obstruction is caused in this area means the CSF it accumulated in the third ventricle itself. Okay, third ventricle itself. So the third ventricle shows in CT they may be in an enlarged size. Okay, second one is poor absorption. So less common is a problem which absorbing CSF fluid. So as we all discussed before, so absorption happen only in arachnoid granulation. So you can see this image also, arachnoid granulation. So that is poor absorption. Third one is overproduction. So rarely cerebrospinal fluid is created more and quickly and it can be reabsorbed, that means absorbed. So these are the main three reasons for having cerebrospinal fluid extra, that means a larger amount of CSF that stayed in our brain. So if CSF is stayed in our brain, what kind of symptoms we are having to face means first. So mostly I already previously said that CSF, that means hydrocephalus is common for an congenital people. So congenital means infant. So infant. So most common signs and symptoms of hydrocephalus is changes in head. That means head circumference is more than a normal, an unusual large head. So you can see in the previous image itself, a rapid increases in size of head, a bulging or tense soft spotted fontanelle on the top of the head. So these are the symptoms of infants. So physical signs and symptoms means, so what are the physically signs and symptoms means, the baby having nausea, vomiting, sleepiness or sluggishness, lethargic, so irritability, poor eating, especially seizure, eye fixed downwards and problems with muscle tone and strengthening. This because of increasing in the pressure that having the brain. So what are the signs and symptoms of toddlers having? Toddlers means in the age of above 15. So physical and signs and symptoms that includes headache, blurred or double vision, abnormal eye movement, abnormal enlargement of toddler's head, sleepiness as well as nausea, vomiting, unstable balance, poor coordination, poor appetite, loss of bladder control. So these are the signs and symptoms of having hydrocephalus in toddlers. So toddlers behavioral and cognitive changes are there. So first one is irritability, second one is changes in personality, third one is decline in school performance, and fourth one is delay or problem with previously acquired skills such as walking or talking. So these are the behavioral and cognitive changes in the toddlers itself. So as you all said, so most of the hydrocephalus are congenital, but it can occur in over the age of 60. So these are the common symptoms of people having hydrocephalus more than 60 age. So first one is headache, sluggishness, loss of coordination or balance, loss of bladder control, vision problem, decline in memory, concentration on other thinking skill that may affect job performance also. So these are the symptoms while CSF occurs in the old age people. So among adult 60 years, so loss of bladder control, as all the symptoms are mostly same, because so memory loss, so CSF is in there. So progressive loss of other thinking and reasonable skill, difficulty walking, often described as an settling gait or feeling of the feet being stuck, poor coordination or balance. So this is about hydrocephalus, what is hydrocephalus, the diagram and the causes, main causes and signs and symptoms. Here, so we are going to diagnose. How we are going to diagnose hydrocephalus means, first one is neurological evaluation. Although we are having conditions in brain, so we have to examine the neurological evaluation. So hydrocephalus causes various abnormalities in the brain because of damage to the brain tissue. The doctors perform various tests evaluate the severity of neurological condition. So what kind of neurological evaluation means? Muscle activity test and sense organs test and mobile test, that means movement test. So these are conducted to evaluate the neurological health of the person having hydrocephalus. So first diagnosis is neurological evaluation. So that comes under muscle activity test, sense organ test, movement test. So second, so we are having a radiological examination. So although every diagnostic procedure we having a radiological finding, so first and foremost is CT, and second one is MRI brain, and third one is MR-CSF flow study. So how the CSF is flow inside the brain, so we can see in the MR-CSF flow study. And fourth one is ultrasound. So this test is often used for an initial assessment for infant because it is a relatively simple low risk procedure. Although you can already note, so ultrasound having so much, that means very less much of radiation itself. So it is safer side for using ultrasound for than pediatric patients. So the ultrasound device is placed over the soft part, that means fontanelle, on the top of the baby head. Ultrasound might also detect hydrocephalus before birth during the routine prenatal examination. So inside, that means inside the mother's womb, ultrasound may detect, so pre-wear itself, that means prenatal examination. So these are the radiological examinations to identify hydrocephalus, so in all kind of age people, that means pediatric age itself as well as over the age of 60. So this is about management of hydrocephalus. To decrease CSF production by using pharmacological agent, example acetonitide, furosemide, isobupropion, that means glycerol. So but these medications currently are used only for temporary basis. So both drugs act to reduce the production of CSF by the choroid plexus. So hydrocephalus, so not manageable by in the medical management. So it is a temporary basic. So even though the best management methods of treating hydrocephalus is only by surgical method, so it has a high effective rate, so comparative to the medical management. So medical management is basically a temporary basic management. So second, what are the surgical technique to minimize the CSF, that means hydrocephalus means? The only effective treatments are surgical. So as we all discussed about, so depend upon the needs of the person, hydrocephalus can be treated in varieties of way. Following are some of the surgical options available for treating hydrocephalus. So surgery is the only effective treatment for hydrocephalus. So first commonly used surgery is ventricular peritoneal shunt, that means VP shunt, that means ventriculoperitoneal shunt. So ventricular means inside the brain ventricles. So peritoneal means our abdominal cavity covering peritoneal. So these two ventricles and peritoneum having one shunt called as VP shunt. The most common treatment for hydrocephalus is surgically insertion of drainage system called a shunt. It consists of long flexible tube with a valve that keeps fluids from the brain flowing in the right direction at the proper rate. So you can see that image. So one tube is connecting ventricles, the another end is connecting in the peritoneal cavity. So ventriculars and peritoneal cavities are connected in between. So when excess of CSF is produced by an ventricle, that means choroid plexus, the absorption is in this tube. It is transmitted to an peritoneal cavity. So that peritoneum is excreted by the excess fluid excreted by an urine itself. So this is a common method of treating surgical management for hydrocephalus, that is ventriculoperitoneal shunt. The most common treatment of hydrocephalus is VP shunt, that means ventriculoperitoneal shunt. So one end of the tubing is usually placed in one of the baby's brain's ventricle. The tubing is then tunneled under the skin to another part of the body, example abdomen or heart chamber. So heart chambers is not mostly used for, but abdomen, that means peritoneal, is the commonly placed using VP shunt procedure. So where the excess fluids can more easily absorbed. So people who have hydrocephalus usually need a shunt system for rest of their life. They require a regular monitoring, as well as this procedure having complication itself. So we can discuss in the later slides. So shunt system, a shunt drains excess cerebrospinal fluid from the brain to another part of the body, such as abdomen, where it is more easily absorbed. And second procedure is endoscopic third ventriculostomy. The name itself, endoscopic third ventriculostomy. So during endoscopy, you may also know endoscopy means a tube-like structure that having an camera vision. So we can directly hold inside you can see that image. So directly into the one hole placed during this ventricle, that means third ventricle. So endoscopic third ventriculostomy is a surgical procedure that can be used for some people. The surgeons use a small video camera, see inside the brain. Surgeon make a hole in the bottom of the ventricles or between the ventricles to enable cerebrospinal fluid to flow out of the brain. So this is procedure called as endoscopic third ventriculostomy. Tummy means removal. So endoscopically the excessive CSF is removed through an endoscopic procedure. That procedure named called as endoscopic third ventriculostomy. So these two procedures having complication itself. So both procedures can result in complication. Shunt system can stop drainage cerebrospinal fluid or poorly regulate drainage because of mechanical problem. So you can see this image. So in case of CSF is produced by this, so any kind of mechanical damage during after the procedure means the CSF is not reabsorbed or drained properly from the brain. So after it can stored itself inside the brain. So this is one major complication, mechanical problem, blockage or infection. So complication of ventriculostomy include bleeding and infection. So ventriculostomy means endoscopic ventriculostomy. It also having bleeding and infection complication. So any failure requirement prompt attention, surgical intervention or other intervention. Fever and recurrence of the original symptoms of hydrocephalus should prompt an appointment with your doctor. So if complication arise, so you must have to visit an neurologist for that, what kind of symptoms you have that. So other complications of hydrocephalus. So previous complication is about surgery. So this is about complications of hydrocephalus. So delayed developmental milestone. So milestone you may also note. So periodical age, that means in pediatric, so age group milestone has to be developed. So that has to be delayed. Second one is cognitive dysfunction. Third, poor coordination and balance. Vision changes such as double vision, seizure, so lack of focus and concentration, dementia, speech problem, physical and developmental disability, and even death. So these are the major complications of hydrocephalus. So as you all know, so this is about hydrocephalus. CSF means excess of CSF fluid that accumulates inside the brain and spinal cord. So even though the CSF is produced daily for an adult for 500 to 700 ml, so in the choroid plexus. So this CSF is production for main purpose of braining, that means cushioning the brain, from brain metabolic, that means brain waste metabolic reabsorption. So these are the main and foremost important functions of CSF having our body. So this CSF is reabsorbed in the arachnoid granulation. This is about the clinical presentation of babies having hydrocephalus. So these are the physical signs and symptoms of toddlers, behavioral and cognitive changes, young adult and middle-aged group, older adults. Diagnostic method: first neurological evaluation, radiological examination like CT, MRI, ultrasound. So medical management is for a temporary basic. So 4 more drugs, that means acetomaloside, furosemide, isobroside and glycerol. And surgical management, so only effective treatment only for hydrocephalus is surgical management. 2 main procedures: first one is ventriculoperitoneal shunt, that means ventricles and peritoneums are interconnected, and second one is endoscopic third ventriculostomy. So complication of this surgery is having, and this is the final, that complication of hydrocephalus. Thank you. This is about hydrocephalus.